you know, there were a few. You're videoing me.
Well, that's the only way I know how to do it.
There were. I didn't see anything new that we didn't expect from what we saw in clinic. There were tumors along the back part of his bladder, and then there looked like there may have been some abnormal tissue along the bladder neck. I don't think the tissue of the bladder neck was tumor, but I resected all the tissue and the posterior part of the bladder, and then I sent that separate, and then got a resection around the bladder neck of that tissue there. It's not uncommon for the tissue around the bladder neck to sometimes have a little bit of a friable appearance, and I just want to make sure it's not tumor, so I sent that off too. It doesn't look like malignancy to me.
Okay.
This looks to be not growing into the bladder from my naked eye, but my naked eye is not a microscope, and so we'll send it to the pathologist. They'll look at it and they'll determine, you know, the grade and the stage. Everything looked really good when I finished, and there wasn't any evidence of any bleeding, although there will be some blood in his urine. The urethra is very sensitive to being abraded, and there was a scope through his urethra, so I didn't work in the urethra, but that got abraded, and so that's usually what bleeds mostly.
Okay.
And so that'll be like bright red blood, and it'll look like a whole lot, but you got to remember, you know, you put a few drops of food coloring in a gallon of water, it turns the whole thing that color. So for the next few days, he'll have what looks like a lot of blood in his urine, but I wouldn't be worried.
How many days does that usually last?
I would say 7 to 10 days pretty reliably. Sometimes he'll have it today and tomorrow for sure, and then it may kind of come and go for the next. It can come and go even for, you know, a few weeks.
Oh, okay.
Generally, it's, you know, 7 to 10 days. I'm sitting at home with an antibiotic for 3 days, pain medication, and something for burning.
Okay.
If he has any problems or issues, you just give me a call. Otherwise, I want to see him back in about 7 to 10 days. I didn't leave a catheter because he didn't need one.
Okay.
If he can't pee, he'll have to wear a catheter home, and we'll arrange for him to come back and get that out in probably about 5 days if he does have to do that.
Do you have to put him back out to put that in?
Ma'am?
Do you have to put him back out?
Oh, no.
Okay.
They'll put him in. The nurse will put it in the recovery room if he can't pee.
Okay.
And then I shot the Dian's kidneys, and that looked fine.
Oh,
Obviously,
good.
up into the yours kidneys, that looked perfectly fine. So, you know, my hope and my thinking right now is this is going to be non-invasive disease, but pathology will be the proof in the pudding, as they say.
Okay.
So he'll probably be in there for a couple of hours, and then they'll call you. He'll move over to a transition area, and then once he's awake and eating, or drinking at least, and peeing, he can go.
Okay, great.
All right?
And now, will y'all call us to make the appointment, or do I need to call y'all?
You're supposed to fax it to our clinic, call
Okay.
from here to make the appointment, and you shouldn't have to do anything. But if for some reason, you know, Tuesday of next week you hadn't heard from us, just call us.
Okay.
And you know, you have our contact number and stuff, right? You need a card?
Yeah, if you have a card, that'd be great.
Got a card. Good.
Thank you.
Sure. But yeah, he did fine. Did nothing unexpected. Really very straightforward. So
Okay.
I expect him to do okay. He's going to have a lot of frequency and urgency of urination and all that kind of stuff. But that's to be expected.
Okay.
All right?
Awesome.
All right. So y'all just sit